This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Today our guest is licensed acupuncturist and herbalist Dan Schwartz. A graduate of New England School of Acupuncture, Dan has been practicing in Dartmouth, Mass. for over 25 years doing acupuncture and custom blending Chinese medical herbs for his patients. And he's on the board of trustees for the New England School of Acupuncture. Welcome, Dan.
Hi.
Thank you for coming to our show.
Thanks for having me, Jack.
Dan, instead of talking about the broad spectrum of Chinese medicine, I know that we will cover some of it, you just can't avoid it, but let's talk specifically about acupuncture first, about what acupuncture is, the goal of an acupuncture treatment, and how you determine what points to use in the body, and a little bit about Qi, too.
Okay. We'll start off with Qi. Qi is the energy of life. It's been put in, people have tried to put it in different terms. It's kind of hard to say because it's the basic energy, the essence. One teacher I knew, he used to say that Qi was energy on the verge of becoming matter. This Qi flows through the body, helps to move the blood, and the blood helps to move the Qi. So they work very closely together. In an acupuncture session, what do I try to do? We look for where the Qi is blocked. You can have blockages for different reasons. It can be trauma will cause a break in the flow, sometimes a weakness, a deficiency. So we have different ways of treating both those things. For example, if there's an energy blockage, we would use some acupuncture needles, and the needles are very fine. I'll show you one. They're pre-sterilized, disposable, and you can see how fine that is.
Very fine,
yeah.
Very flexible.
Yeah.
Yeah.
So I'm actually going to dispose of this one. So when someone comes in to the clinic, what I try to do is try to find out what's wrong. You listen to what the complaints are in general. If they have pain, where is it? What's the quality of the pain? Is it a sharp pain? Is it a dull pain? Because those indicate different causes for us. So first thing I would do after listening to the person, if it's appropriate, then I would take the pulses. The pulses also help to find where the energy is blocked in the system.
Show on my hand how
Sure.
you would do the pulses, because it's different than just taking
Absolutely.
the blood
We're
pressure
looking for a
pulse.
lot more than just the speed. We're looking for different qualities. We're looking for how strong it is. A good strong, you have a very nice pulse.
Gee, thanks.
Yeah.
So you've got 3 fingers there, and you're pressing lightly and pressing deeply.
Yeah. So we're using 3 positions here to take your pulse, and we feel it superficially, then we go down deeper to the bone level, and then come up and see the shape of the pulse as we come up. And each position is a little different. This is for the lung, this is for the spleen, and this is for the lower part of the body, the kidney energy. And the speed, the width, the strength, they all tell us a little something. This is all the energy side. On the left side is the blood side, and we think that kind of makes sense because your heart is on your left side. So we would go on the left side, it would be the heart, then the liver, which also has to do with the blood, moving the blood and filtering the blood, and the left kidney, which is a little, we get into like yin and yang at this point, which is another thing we may have to explain. Yin and yang are, it's a way of seeing the universe in relationship to everything else in the universe. So, for example, yang is hot, yin is cooling. Yang is expansive, yin is contractive, but they're relative terms. So male is yang, female is yin. The sun is yang, female is yin.
The moon.
The moon, rather, thank you. So if I were to stand next to you, I'm a little taller than you, I'm male, so I'm yang, you are yin. If I were to step out of the picture and someone smaller than you came in, then you being the bigger of the two, you then become the yang. So they're fixed, but they're not really fixed. It's more a way of seeing the whole universe in relationship to everything else in the universe. So when we ascertain what's wrong, where the pulse is, where you're deficient or where you're excess things in the lung would, too much mucus, someone has a lot of mucus. So that would come up in the pulse and we'd find an excess. Then you find out where there's a deficiency. If there's an excess one area, there must be a deficiency somewhere else. So we try to break up the excess, get rid of the excess, and strengthen the deficient area at the same time. So we always are trying to create balance. That's the key to acupuncture, is balance. And you actually don't have to have something wrong with you to come. We can do preventative medicine. We can help to build the immune system, which is another thing.
Yep.
Flu and cold season, I have people that come in, like 2 or 3 treatments just to kind of get the energy going.
And they use acupuncture widely for many different things, not only prevention and wellness, health maintenance, to cure internal diseases, also
I don't
for
like the word cure.
to balance.
Okay. We help things along.
Okay, great.
That's too.
We're helping things.
Yeah.
So anyways, if someone has symptoms like arthritic inflammation or digestive issues, you're balancing out the problem so that the body can heal itself.
They would have, why did they get the arthritis in the first place? Well, there's a deficiency somewhere that allowed that to get in. We see, for example, arthritis as cold that gets in the joints. When we treat that, we'd not only use the needles that I showed you, but we'd also use something called moxibustion, moxa, which is an herb called Artemisia vulgaris. It's mugwort. It's ground very finely, and we would burn it. So if there's cold, if someone's cold, you burn it, burns about 600 degrees, and we hold it about an inch away. And this is something I also give to patients sometimes if it seems to provide some relief in the clinic. I'll give this to them to take home. I can't give them needles to go home with, but I'll give them moxa, and they can do it at home. It gets a little smoky, but it's a very soothing warmth. And the difference is if you were to hold a tobacco cigar or a cigarette or something like that near, the heat rises. We know heat rises, but this has a quality. The heat kind of sinks and stays with you, so it penetrates more. And you know, if something's stiff, how do you loosen it up? You heat it up. And that's what we're trying to do. Arthritis, people get very stiff. So the same kind of thing.
And acupuncture is also used in hospitals in China too, for many different reasons, including anesthesia, right?
It's fabulous for anesthesia. I've done some acupuncture for tooth extractions, root canals, where some of my patients who could not tolerate the anesthesia, then they would call me, and it works very well. Had a few incidences, and one dentist told me when he was doing a tooth extraction, he said it was noticeably less bleeding. And then we found out later that anesthesia can cause bleeding, so it can be very beneficial.
That's great.
It isn't something I do all the time, but on occasion we'll do it. But that's how actually acupuncture got known, is they did acupuncture anesthesia on, I can't remember the guy's name, he went with Nixon to China. He was a writer for, I think, the New York Times. His name escapes me at the time. But when they saw this, of course, he wrote it up, and it was, they also used it, I think he had some discomfort afterwards, so it can be very good to help the post-surgical discomfort and pain. And so he wrote about it, and then that was, I think, in '74, and since then it's grown by leaps and bounds here.
Here in the United States.
I started practicing in '84, and I tell people, you know, I'm an acupuncturist, and say, what? But now everybody knows what acupuncture
Everybody knows it. You know, but not everyone has experienced it or has actually seen it. I was wondering if you could do a little demo either on yourself or myself, just so that people can actually see what it's like.
Well, the first thing we do is clean the area that we're going to needle. So we'll just clean this. Go here, sure. And a very easy way to do it, we can just insert the needle, but that's kind of painful. The Japanese came up with this idea of using a tube. So you can see the needle sticks up about 1/8 of an inch or 1/4 of an inch at the most. And if you take it and you press down, and then we just press down lightly with the tube and just tap it in.
So that's sticking out of my hand right there. And
then it would be manipulated.
He's twisting it.
Yeah, and we try and get the chi.
Just to stimulate the chi. I can feel
Not bad,
a lot of
so you're pretty sensitive.
energy, yeah. I probably
when
need
you do
that.
energy work.
I probably have a buildup on that meridian, huh?
That's a very commonly used point. That's a point called large intestine 4, which can be used for headaches, anything in the upper body, but can also be used internally, used a lot in treating OBGYN things. Very good for pain,
Now,
discomfort in general.
what would you use this for?
The electricity, sometimes, what I just did when I stimulated the point, I moved the needle a little bit, instead of me having to do that constantly to get the chi moving, to get the energy moving, we'd hook up electricity to 2 different points, and 2 things happen. Actually, you stimulate the needle, so you get a little bit stronger reaction, but also when you run electricity, if I were to do something from here to here, you create a magnetic field in between, and the magnetic field can be helpful in healing.
Is this a Western addition, or is this something that they use in China as well?
Oh, it's used in China as well. Yeah, it's only about 80 or 90 years old. The
As
use
opposed
of the
to 3,000
years. Yeah. And actually, there's a book on. I want to take it out.
Okay, he's going to take it out.
Good. Not bad.
No blood, no nothing.
Good.
Very easy. So children
very
commonly get acupuncture.
Yeah, I would treat. Sometimes you can treat young children. Sometimes for bedwetting, it's very good for that. Bladder control in general. Sometimes.
What about common things would be ear infections?
You can use it for that. That's a point. Again, you could use a point here because this is what we'd call a control point that controls everything from the head up.
Right.
But it also works internally down below, so it can be used for a very commonly used point, very powerful point. You can use it with finger pressure, thumb pressure. If you have a headache, or you can just put pressure there for a moment and move the area.
There.
Yeah.
And so the moxa would be something that
Then
if I kept getting headaches, and I could get some moxa from you, and you'd show me how to hold that moxa over that
We would
point.
hold it after the needle came out. You hold it about 1 inch away if this were burning, and you'd feel the heat, and you take as much heat as you can, and then the area gets red. And that heat stays, and the heat it moves circulation, it moves blood, heat's very important. So we use it a lot of times as opposed to ice. Ice can be really helpful as far as numbing pain, but it does nothing for the healing.
So how do you know which acupuncture points to use? And before you go into that, what are acupuncture points?
Acupuncture points are points of low electrical resistance. So Western science started accepting acupuncture when we said there was a point midway in this bone, and when you scrunch up the thumb to the index finger, right at the top there, when we describe where the point is, when they take their meters, they can actually measure the electrical resistance. So this is when Western science started saying, oh, well, there is something to this. And there's a certain way of finding points. We would take the forearm, and we know that it has 12 divisions. So we would take and divide the 6 down to 3, and then it's easy to find 2, and they have other guidelines. Not only that, but this particular point is at the junction of 2 bones. So then that would be needle. But how do we get to that is when someone comes in the clinic, sit down, we do a complete intake. What's going on? What's the main complaint? Then we would do the diagnosis. I would take your pulses, find out where you have excesses, where you have deficiencies, and look at the tongue, perhaps palpate the area or the abdomen, depending on what's appropriate. And then by making a diagnosis, automatically tells me what to do. This is one of the beauties of it. It's almost, you can't say no thinking, but it's very helpful, gives you specific guidelines to go by. So each acupuncture point has an action and an effect. This point here that I needled on you has the effect of bringing things down strongly. So a headache, you want to bring, that's an excess in the head, you want to bring that down. So that's why we'd use that. There are other points that do that. There are points that can raise the chi, raise the energy. One would be at the top of the head, which kind of makes sense that if you're needling this and you're drawing the energy up, if someone were pale, cold, we would do a needle, maybe some moxa. And I've actually needled someone who's passed out, very white, and did a needle and some moxa, and you could see the waves of blood, the circulation just coming up. It was very interesting. You know what to do. Once you know what the problem is, you've made your diagnosis. And our diagnoses are a lot different than Western medicine. We use terms like stuck chi or stuck blood, stuck liver, chi. We also relate to the organs, as I was talking about the palpating the pulse. You see where it is. Very commonly in this country, because we're so many type A people, so you have this liver stagnation. People are very stuck. Get things moving, free up the energy. And the idea is not so much that we do the healing, but it's to get your body to do the healing. This is why we go for that balance. I don't know if you know the yin-yang sign with the
a little bit, yeah. Well,
that's about balance. And we try to create balance. Once you create balance and harmony, then the body will take care of itself, giving the opportunity.
You're not limited to just using one acupuncture point.
Oh no,
Usually.
Typical treatment would be anywhere from 6 to maybe 10 points. Some of the points are bilateral.
Okay,
so one point would be 2 needles, but 10 points.
And how long does the session last? How long do you usually leave the needles in?
Usually about 20 minutes to half an hour, depending, if someone's real depleted, well, you give them, or has a very serious chronic problem, they need a little more time. So anywhere from 20 minutes to half an hour or so, and if we're doing both sides of the body.
So you would lay down on your back, maybe do the front?
Not all the time, so if it's appropriate.
Yeah. And how often does someone usually come for acupuncture? Say if someone had migraines versus someone who came in and had a cold and a cough or something more acute.
The migraines, a lot of people like to come once a week. It's a little more effective if you do it twice a week. In China, with an acute problem, you're treated every day for 10 or 15 days. That's one treatment. And then you get 5 days off. If you need another course of treatment, then you would get another one. Chronic problems, probably be every other day. But somehow we got away from that in this country, and people like this once a week thing, which is okay. It's not real good. More is better generally. Mm-hmm. So twice a week. And when someone suffers from migraines, I usually like to have them come in. I mean, I can treat you without having the headache or the migraine. But I tell the patients, if you get one, call me. If I can get you in, I'll get you in right then and there. That way we can see what's going to give you relief. I expect some relief right away, not a cure, but some relief. So the goal generally is to make the problem, like migraines, have them come less often, less intense, so that someone's not totally debilitated, doesn't miss work.
Right.
That kind of has to hide in a dark room. But it's very good for migraines.
And then what about, well, there's two things. One would be, say, like a reflux, something where someone is having heartburn and having problems with digestion.
So again, we could use that point because it sends things down, because that's the acid reflux things are coming back up. So we would do points on the periphery, we do points on the leg. There's another famous point just below the knee that's very helpful for digestive issues and also for building the chi, building your energy up. So we would do points, and probably some local points to get the, if it's stuck, you say, well, I get stuck here all the time.
Yeah.
Well, we'd do a needle there to get it moving. And it can be, I've had great results doing that.
So how about either, like some people have asthma, and it's always worse during, different times of the year.
Yeah, cyclical, right, that happens. Generally, if someone has asthma at a particular time of the year, I like to start about a month before, or someone with allergies, a month before they expect their symptoms, and then you work right through that. And I've had very good results turning things around noticeably.
And would you typically give them we talked in the introduction about how you use medicinal herbs, Chinese herbs, or you put together a special tea for them or something that they would drink in the meantime, or that would be helpful for their condition?
Absolutely, and the herbal formulas are customized. We'll have a basic formula of maybe 5 or 8 herbs, but it can be customized to fit you as an individual. And that's the beauty of Chinese medicine. We're always treating the individual, not the problem. Like, two people can have asthma, and they can be very different treatments, because one has what we'd call hot asthma, another one has cold. Heat or exercise can cause their symptoms, whereas the other person, you go out in the cold weather, they have their symptoms get worse with the cold weather. So that person, again, would get the moxa, get the heat, cold, because we want to warm them up. Someone's hot, you don't want to use the heat.
Right.
So we do points that it would be cooling, help to get rid of some of the mucus, draw mucus down. There are certain points that have the ability to do that.
So, and then the other question I had was about something like if someone had tendonitis, or maybe an old injury to their shoulder, and they've been playing tennis, and it's acting up as acupuncture.
Oh,
good for that.
Very appropriate. Tendon problems can be difficult because they're very deep in the body. Sometimes a tendon can take longer to heal than a bone. And ligaments also can be very difficult because there isn't a lot of blood flow there. So the acupuncture can be, when I manipulated the needle on you, we can draw the energy there, or we can disperse it. So in the case of tendonitis, they have things are stuck there, so we want to disperse that. But it may be some cold in there, so we also want to warm it up. So you disperse it first, get rid of the excess, then warm it, increase the blood circulation, again, letting the body heal itself.
That sounds good. And sciatica, I think acupuncture, that was the first class I ever took in acupuncture, was they treated sciatica. Everybody who had sciatica went up and got treated.
And that can be very different also, because it depends on how your body handles it. If you, some people, again, heat brings relief. Other people they want to use ice because it's hot. So we would use cooling herbs as well as cooling points with the acupuncture. So again, everything's customized to fit you as the patient. I'm treating you, not just the problem.
Yeah. And I can see where you probably treat a lot of female issues. Menstrual issues,
Great
menopausal issues, even libido issues for men and women, and those type of things.
Impotence. It can be, and we've been doing a lot now with infertility, and not just the acupuncture, but it's combined with the in vitro, and the combination of the two seems to work better than either one individually. So I had a number of cases. In fact, I just had one woman I was treating not long ago, just got a call, and my office manager called, "Oh, you got another one pregnant?" It's a good thing my wife isn't here, right? But no, it's very, because we put the body in balance. And again, we're looking for, oftentimes, infertility could be cold down there, so we'd warm it up, and that's why I give the patient the moxa to do it at home. Keep that area warm. The more you do it, the more it builds, and you create a better environment for the fetus. For women who have PMS, well, things are stuck again. In the menstrual flow, you get some clotting. Well, that's obviously stuck blood. So we try to get the blood moving. We have certain herbs that are very good at that, and there are also a lot of different acupuncture points that are very good to get the blood moving. When you get the blood moving, you get the chi moving, and it's interesting. Almost every time when I treat people, they get so relaxed. I actually have people fall asleep on the table. It's hard to explain. Western medicine came up with some terms. Endorphins and enkephalins are released, and you get this. Yeah, I think it's more than that.
I think it's a healing state.
Yeah, and that healing state is somewhere in between waking and sleeping.
Yeah.
That's my interpretation. You get them into that zone.
Yeah, the healing zone.
Yeah, the healing zone. We got a new one. Good name for a book.
Yeah. So just to wind down a little bit, we've talked a lot about acupuncture. But I know that you use other techniques in your practice as well, like Tuina.
I do a lot of Tuina.
So tell us a little bit about how you might coordinate the different modalities, and use them on one patient.
And we also use cupping. I did not bring any cups, but we also use cupping, which also can help to increase circulation, get rid of stagnation. So if someone came in with a neck problem and tight shoulders, that kind of thing, I would do the needles first. Probably if they're that tight, I would use some electricity to make it stronger. So you see kind of a pulse. It's very similar to a TENS unit, except instead of having pads, we hook it up to the needle, so it's a little bit deeper, and you get a much better result than a TENS unit. So after doing that, then I want to really get the energy moving. I will do some hands-on Tuina. I don't do a long session like someone who's just a Tuina practitioner. I'll do maybe 5 or 10 or 15 minutes of it, and just to really get the energy going. Or use cups at that point. Sometimes after the Tuina or after the cupping, we would use the moxa again. Very helpful, and people think, well, why the heat all the time? The body works very hard at keeping your temperature, 98 point, whatever they say it is now. So that can be draining. If you have a problem with the temperature, the acupuncture can also help to
So a lot
balance.
of women suffer from cold hands, cold feet.
Yeah, very, very common. Acupuncture can be excellent. And oftentimes you'll see they're not getting the circulation to the hands and feet. Why? Because the blood's stuck here, the energy's stuck here. So we release it from here, get it going, rechannel it, and then it is much more able to get to the periphery and warm the hands and feet.
Okay. Well, Dan, thank you so much for coming on the show, explaining what you do around acupuncture and the other methods of Chinese medicine. I'm sure that we could have done actually a whole show just on Chinese herbs and your combinations that you make for your patients.
Yeah. Maybe another time. It's fun. Thank you very much.
You're welcome. You can contact Dan at the Acupuncture Clinic of Daniel R. Schwartz at 508-997-4158 or email him at danielrschwartz@comcast.net. Thank you for joining us today. I'm your host, Jackie Bell. We'll see you next time on Living Healthy.